Hello, welcome everybody to this very short video on maxillary artery. Maxillary artery is a branch of the external carotid artery. As soon as it leaves the external carotid artery, it gives off multiple branches, and based on that, it is divided into three important divisions. There is the division 1, this is the second division, and another division is the third division. Now let us look into the first division. The first division starts with the introduction of this wonderful character damia. If you remember damia, you will remember maxillary artery. And by damia, what do we mean? It's the deep auricular, anterior tympanic, middle meningeal, inferior alveolar, and then we have the accessory meningeal. Now we are seeing the first division in the anatomic model. Now let's zoom into that area and see the branches. Can you recollect the branches? We have the deep auricular, anterior tympanic, middle meningeal, inferior alveolar, accessory meningeal. So you have to remember damia, and the first part is in your mind. Now, let's look into the second part of the maxillary artery. Well, this is all about damia. When you are talking about maxillary artery, remember damia, 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 and damia. But can you see that she's wearing a map of Bangladesh in her clothes? That's what you have to remember. Map of Bangladesh. BD means Bangladesh. What are the branches? Here we have the branches. We have the mesenteric branches, we have the pterygoid branches, the medial pterygoid and the lateral pterygoid. Then we have the buccal branch. Then we have the deep temporal branch. There are two deep temporal branches. One is the anterior deep temporal and another one is the posterior deep temporal. And that's the mesenteric branch. Then we have the pterygoid branches, lateral pterygoid, medial pterygoid. Then we have the buccal branch. Now we are going to see the deep temporal branches, which is the anterior deep temporal and the posterior deep temporal. And now you can see in this that there are the four branches, the four major branches: mesenteric, pterygoid, buccal, and deep temporal. And we should keep this in mind. There are two deep temporal branches. One is anterior deep temporal and the other one is posterior deep temporal. The last part, that is the third part of the maxillary artery. And how do we remember it? Damia, who is having what? A map of Bangladesh, is a pretty sweet girl in pajamas. Now here are the branches: artery to the pterygoid canal, pharyngeal, then we have the spinopalatine, then we have the greater palatine, infraorbital, and the posterior superior alveolar artery. Now we are going to see this third division in the anatomic model. This is the third division, as you can see. Now let's focus into this region, actually the pterygoid region, where you are going to see all the branches. Now, can you recollect? Artery of the pterygoid canal, pharyngeal branch, spinopalatine branch, greater palatine branch, infraorbital branch, and posterior superior alveolar artery. This is all about the story of damia, who is wearing a map of Bangladesh. And who is damia? A pretty sweet girl in pajamas. This is the full picture of the maxillary artery division. So let us run the mnemonics fast. Damia, D-A-M-I-A. She's carrying a map of Bangladesh, which is M for mesenteric branch, P for the pterygoid branch, B for buccal branch, and these are the deep temporal branches: anterior deep temporal and the posterior deep temporal. Now what about a pretty sweet girl in pajamas? A pretty sweet girl in pajamas. Now let's recollect the branches by name: deep auricular, anterior tympanic, middle meningeal, inferior alveolar, accessory meningeal. And she's carrying a map of Bangladesh, which means mesenteric, pterygoid. There are two pterygoid branches, medial pterygoid and the lateral pterygoid. Then we have the buccal branch, the deep temporal branches, anterior deep temporal and the posterior deep temporal. Now, when it comes to the third part of the maxillary artery, we have the artery of the pterygoid canal. Then we have the pharyngeal branch. Then we have the sphenopalatine branch. Then we have the greater palatine branch, the infraorbital branch, and the posterior superior alveolar artery. Remember this: Damia carrying a map of Bangladesh, a pretty sweet girl in pajamas. Trust me, you know maxillary artery branches quite well.